Thank you. So welcome back. Excited to be here for the second day, and I'm excited to start off today with by the chance to introduce our first conversation of the day. So last month, I had the privilege of going down with my friend Gene Accius, who I'll introduce in a second, to Stillman College in Tuscaloosa for a town hall on rural health. Um, and I got a chance to be part of the vibrant Stillman community and meet Yolanda Page, who's the relatively new president of Stillman College, and get a sense of her vision for not just the college, but the university and the communities they serve. And I'm very excited to welcome both Jean and Dr. Page up on the screen. They're going to start this off virtually. If we could put them up, and I'll introduce Jean. Give Jean, who you may have seen here before, a bit of an introduction, and then turn the conversation. There he is. Turn the conversation over to him. So Jean, as many of you know, is the president and CEO of CHC, Creating Healthier Communities. CHC is a national nonprofit that brings together other nonprofits, businesses, and communities together around a shared commitment to better health and well-being. Prior to CHC, Dr. Accius was a member of the policy team for the Centers for Medicare and Medicaid Services, and many of us know him from his role immediately before CHC when he was the Senior Vice President of International Affairs and Global Thought Leadership at AARP. Had a great time at Stillman College with both of our first guests, and just delighted to have the chance to welcome them virtually. Hopefully at some point it will be in person, but virtually, to the Century Summit.
Well, good morning, everyone, and it's so good to be with you virtually. I wish we could be here in person. It is an honor to be here to have an important conversation on rural health, longevity, and the opportunities that exist when we take an intergenerational approach to solving challenges. We know that in rural communities, there are significant health disparities. Nearly 1 in 5 Americans lives in a rural area, yet rural residents have shorter life expectancies compared to their urban counterparts. Factors like higher rates of chronic disease, provider shortages, limited healthcare access, and socioeconomic challenges all contribute to this gap. Additionally, over 100 rural hospitals have closed in the past decade, making access to essential services even more difficult. Without bold action, these disparities will continue to impact not just individuals, but entire communities for generations to come. However, we also know that rural communities are rich in resilience, culture, and also opportunity. Longevity is not just about adding years to life. It's about ensuring those years are lived in good health, with purpose, and strong and connected communities. This is where intergenerational approaches become extremely critical. By fostering greater collaboration between younger and older generations, we can create stronger support systems, enhance workforce pipelines in healthcare, and ensure that people at every stage of life, whether children, working adults, or older adults, have access to care and resources they need in order to thrive. That is at the heart of the efforts at Stillman College, where I'm honored to serve as a trustee. Stillman is uniquely positioned to be a driving force for change in rural health. With its commitment to education, research, and community engagement, Stillman has the potential to prepare the next generation of healthcare leaders, build partnerships, and leverage innovation to address the unique needs of rural populations. By investing in students and fostering greater collaboration, Stillman is not just shaping individual futures, it is shaping the future of entire communities. To help us explore these opportunities, I am deeply honored to introduce to all of you Dr. Yolanda Page, the president of Stillman College. Dr. Page is a visionary leader in higher education with a deep commitment to academic excellence, student success, and community impact. Under her leadership, Stillman College has positioned itself not just as an institution of learning, but as a force for solving critical challenges, including improving healthcare access, promoting longevity, and strengthening intergenerational connections in rural areas. Dr. Page, good morning. It's so good to see you, my friend.
Good morning. It's a pleasure to be here.
Rural health disparities are often tied to social determinants like transportation, housing, food insecurity. What are some of the creative solutions for tackling these challenges?
So I want to start by saying that I think that solutions, of course, are grounded in collaboration and they're grounded in community engagement. Solutions that are grounded in collaboration and community engagement or community empowerment, I think can effectively reduce rural health disparities and improve overall well-being. And some of those examples that we've been involved in at Stillman include transportation, housing, and food security. So from a transportation perspective, we've been involved with the state's Office of Health Equity and Minority Health to deploy mobile health clinics. So there's been conversations about that. So I think one of the ways that we can do this is by deploying mobile units equipped with healthcare professionals and diagnostics tools to provide services to those rural areas. We all know that telehealth is very important. So I think that expanding telehealth is very important to providing solutions. And then I think rideshare partnerships. Rideshare partnerships can provide subsidized fares or dedicated services to those rural communities. Because one thing we know, particularly in the state of Alabama, West Alabama, the area that Stillman serves, many of those who live in those communities, they do not have their own transportation. So if we can provide them transportation via Uber or Lyft, then that can help with those disparities. It's not just about transportation, but then it's also about housing. So I think that affordable housing initiatives are very important, making sure that people who desire to own their homes, they can. But then we also have to consider those who do own their homes. Many of those homes are older. So how do we provide opportunities for them to rehabilitate their homes? So programs that allow folks to renovate their homes. I think about the cold weather that we're all being impacted by now, weatherizing those homes to make those homes safer, make them healthier, and to reduce the exposure to things like mold, lead, and other hazards. And then, of course, food security. The areas that Stillman served are probably the most disparate in the state of Alabama. Many of those folks live in food deserts. So I think some examples are a community food hub. We do have a community garden on Stillman's campus where we allow citizens to come to campus and harvest the greens that we plant there, as well as the vegetables. For people who are unable to drive to a campus or a place where there's a community hub, I think that mobile markets are very important. And then I think we also have to consider farm to school programs. We need to partner with local farms, examples of programs like at Stillman to supply schools with fresh produce, while also, I think, educating children and their families about the benefits of healthy eating as well as agriculture.
I'm really intrigued by the community garden and really engaging the community. There's so many opportunities in terms of social connection across all ages. And of course, you're also solving a significant challenge in terms of food insecurity. I want to acknowledge, to Ken's point earlier, the tremendous partnership we had in the town hall between the Longevity Project, creating healthier communities in Stillman College. What role do partnerships between higher education institutions like Stillman, healthcare providers, and local organizations play in solving some of the challenges that you just referenced?
Well, the partnerships between Stillman College, healthcare providers, local organizations certainly play a pivotal role in addressing rural health challenges. Uh, And that's done in several ways. It's done by virtue of combining resources. It's done by virtue of expertise that individuals like yourself bring to the town halls. But it's also about the community connections. The community connections, I think, create sustainable solutions. When we bring all of these individuals together, then we create collaborations that leverage the strengths of each partner to tackle these complex issues. issues related to access, issues related to equity, as you've mentioned several times, issues related to the social determinants of health. At Stillman, we're partnering with entities across the state to make sure that we focus on things like workforce development. We have an aim to train the next generation. And by training the next generation, we're preparing our students when they come to Stillman for careers in healthcare and public health. And we are focusing on skills that address rural specific challenges, because the majority of our students at Stillman, they come from rural areas of Alabama and Mississippi. Now, while many of them do choose to stay in Tuscaloosa or go to, I'm going to refer to more urban areas of Alabama, but we do encourage them to return to their communities, because that is where they're going to make more of a difference. That is what we are preparing them to do, to be advocates, to be leaders, and to be impactful citizens in those communities. I think pipeline partnerships and pipeline programs are very important. I think those pipeline programs allow us to be able to recruit and retain healthcare professionals in rural areas. That's very important, because we've all read the articles about how the healthcare professionals in rural areas, they're starting to leave. But if no one stays and everybody leaves, then that's going to be another problem that we're going to have to address in many years. So we want those healthcare professionals to stay in those communities. So we're offering our students scholarships, we're offering them mentorships, and we're offering them training tailored to work in underserved communities. And then it's about interdisciplinary education. At Stillman, we're focusing on developing a collaborative curriculum that focuses on not just public health, but clinical practice that prepares students to address a diverse community. That's all very important.
You know, you mentioned the pipeline, and I remember during my time at AARP, some colleagues and I actually went to Beaufort Jasper. And Beaufort Jasper in South Carolina was ranked one of the lowest in terms of health outcomes. And over 20 years, they became one of the top performing counties in South Carolina. And the question was, well, how did they go from being one of the worst from a rankings perspective to one of the high performing? And a lot of it had to do with the pipeline. A lot of it had to do with actually exactly what you just said, Dr. Page, that really investing in the population and really ensuring that there's incentives for them to continue to give back. And one of the things that they did was that many healthcare providers realized that many of the patients that they were seeing had chronic disease, obesity, and they knew that if they were just treating that patient was likely going home to a multi-generational household. So how do you actually start to address issues like nutrition from a multi-generational perspective? And what they actually did was they partnered with the healthcare providers, started to partner with elementary schools. And what they found was the fact that by just educating the students at the elementary level, they would go home and start talking to their parents about healthy habits. But it also had another unintended positive effect, which was that a lot of these students started to get exposed to the healthcare profession, and that over time, that became part of their pipeline strategy. And many of the healthcare providers today are individuals who actually were born or raised or came back to really help their community. So really thinking outside the box and creating that pipeline across generations is so critically important. You mentioned students, and we know that Stillman has a vibrant student community. How can students engage with older adults in ways that foster intergenerational connections, learning, and mutual support?
So I think our students can do it in a couple of ways. One is, I think because we focus on service at Stillman, we encourage our students to engage with older adults. And one of the ways that we've done that is by creating an intergenerational storytelling program. And so in this program, our students and older adults, they come together to share their life experiences. to share their perspectives and other cultural traditions. This allows our students to document the stories of the older adults through interviewing, journaling. It's very, I would say, organic. So in whatever way the student and the adult, the older adult feels that it works. But I think ultimately what this program does is it fosters mutual respect, learning, and I think companionship between the student and the adult. And so it allows the students to develop empathy. It allows them to develop their communication skills because they may not be able to communicate with the adult like they would with their peers. And it also creates a deeper understanding, I think, of history and societal change, which I think is very, very important. And so this happens over the course of a semester, and then ultimately it culminates in like a storytelling showcase that allows for everyone to see, experience, witness, hear the sense of connection between the generations and the strength, and I'm going to say that again, the strength that evolves from that. Because one of the things that we know is that there's been a gap between the generations. And by bringing them together in an area where nothing is assumed, then it allows for them to be able to make those connections that I think will extend outside of those four walls.
Well, Dr. Page, I'm smiling for several reasons. One is I absolutely love that. The opportunity for generations to come together and really explore the lived experiences. I could love that in part, both because it's a living testimony and living history. And it just reminds me when my first job was actually working at a retirement community, and I was working in the dining room at this CCRC. And during the breaks, I would actually go sit outside in the courtyard with the residents, and I would just kind of hear their stories. But I'm also smiling because now I'm midlife and I have a 14-year-old. And I was looking at his cell phone the other day, and I couldn't even process what they were talking about in terms of the language. So this opportunity to look for ways to continually connect, I think is critically important. You know, I'm thinking about all of this, and we focus on some of the challenges. We've also focused on a lot of the innovations and solutions across generations. And if you could imagine an ideal future for rural healthcare in Alabama or even across our nation, what would that look like for older adults and all people of all ages and life stages and their communities? What would that vision be?
Now, I'm going to be idealistic here. I'm going to imagine that we're in a utopia. So I'm going to say that it would prioritize accessibility, equity, and a holistic approach to well-being, but not just older adults in their communities, but for everyone. So I think that in this world, we would focus on proximity to providers. We would make sure that older adults are nearby those primary care specialists, those emergency services that they have through expanded rural clinics, mobile units. You've heard me mention mobile units several times. I think mobile units are very important. And then also telemedicine. But one thing we know in rural Alabama, one of the reasons telemedicine has not taken off the way it has in other places is because of connectivity. So we would have to make sure that those areas have the Wi-Fi connectivity that is necessary to be able to engage in telemedicine. I think that affordable services are very important. Cost should not be a barrier for older adults. I think we need to make sure that we're educating them on how they can decrease the cost of their medications. Also, we need to make sure that they understand other routes to receive mental health assistance or care and to receive long-term care. Of course, I think that cultural sensitivity is very important because oftentimes those individuals who live in the rural areas of Alabama tend to be people of color. So we want to make sure that healthcare providers are trained to understand the unique needs and traditions of rural populations, because that is what's going to foster trust and move us towards improved outcomes. I think that chronic disease management is very important. One thing that we know, there is a lot of common conditions like diabetes, hypertension, and arthritis in these areas. So we should focus on education and resources for managing these conditions. And then, of course, ultimately, it's about lifestyle. How do we continue to educate about healthy lifestyles? We mentioned the community garden, but then also exercise. And then there's nutrition. So we need to think about how all of this can be tailored to older adults, how the future children, like your 14-year-old, I have a 15-year-old, our 18 to 22-year-olds at Stillman and other colleges, how we can all be vested in this to create this utopian or ideal future for rural healthcare, not just in Alabama, but in other areas across the United States.
Dr. Page, I am extremely inspired by your vision for the future. And one of the things you mentioned, I really want to kind of unpack it for a little bit, is this idea around ensuring greater equity and that we're meeting people where they are and understand people's lived experiences. And one of the themes, particularly for the Century Summit, is around ageism and the role that intergenerational groups can actually play in hopes in addressing ageism. So as part of this, vision that you have, can you say a little bit more about, how do we as a collective across generations break down those stereotypes to really get close? I love your point about proximity. And in order to get close, one has to be willing to be vulnerable and courageous. And that also means examining and challenging one's assumptions. So when it comes to ageism, sexism, racism, all the isms, how do we really leverage intergenerational approaches to break down these isms?
I think we do it through the community. I
Mhm.
think we find ways to develop a community hub for shared activities similar to what I mentioned earlier, and using these hubs to bring people of all ages together for joint projects, for joint events, and of course for joint learning opportunities. I think these hubs can include community centers. They could be at an education of higher learning like Stillman College, um, for areas that are more rural. It could possibly be at a farm or other outdoor space, but any space where both the older and younger generations feel comfortable and that they can regularly gather. I think that community-driven volunteer projects that bring together the younger and older generations where they can contribute to their skills, that's helpful. For instance, the older adults could share their gardening experience if it's at a community garden, while the younger participants might help with the physical tasks, those things that the older generation can't do. Or we can flip it and we can say that the younger generation can create social media in content while the older generation is gardening to raise awareness about the initiative. So again, it's about allowing each generation to be able to provide input where they find or they demonstrate or they see themselves as having strengths.
Dr. Page, in the last couple of minutes we have together, For those in the audience today, whether they're in person or joining us virtually, what is one thing they can do to make a tangible impact on the lives of older adults and people across all ages and life stages, whether that's in Tuscaloosa or beyond?
So I'm going to go biblical on you here. I think that the one thing that I would encourage everyone to do is to follow God's command to love your neighbor. Matthew 22:37 and 39 reminds us that thou shalt love thy neighbor as thyself. That is something that I take to heart and that I remember every way. And so, one way to demonstrate this love, I think, is by checking on the elderly in our communities. Loneliness and isolation are profound challenges for older adults. It affects their mental health, it affects their physical health, and it affects their emotional health. So I think that if we all would just dedicate ourselves to taking care of our neighbor by fostering connection and compassion, we can help to address some of these issues. I'm not going to say all of these issues, but I think we can address many of these issues and we can promote inclusion for people at every stage of life.
Dr. Page, thank you so much for your leadership, your vision, your partnership. Thank you, Kent, for your leadership, vision, and partnership. We were inspired by the event back in December, totally inspired by the conversation this morning in terms of exactly what is actually possible. How can we reimagine how we deliver care for older adults and people of all ages? How do we really connect between generations? Because in the end, as you just noted, Dr. Page, we're interdependent. And that it is extremely important for us to think in that mindset and ensure that we're meeting the needs of everyone across all stages and life stages. So thank you so much, Dr. Page. Ken, I'm going to turn it back to you, and thank you so much for this morning's conversation.